13. Folk remedies that can steal your memory. The last one is the most dangerous. Have you ever stopped to think about the effects of drugs on the brain? Some common medications can affect your memory without you realizing it. They are widely prescribed for anxiety, insomnia, aches and pains, allergies, and reflux. But studies show that they can silently increase the risk of dementia. The problem is that these effects emerge gradually, without immediate warning. When symptoms appear, the damage may already be advanced. Is it possible to avoid these risks and protect your cognition? There are safer alternatives to treat various problems without impairing memory. In this video, you'll discover 13 medications that can steal your memory. And stay until the end, because the last one is the most dangerous. Let's get started. Are you taking a drug that may be affecting your brain? Millions of people use medicines daily without knowing all their effects. Some drugs can alter neurotransmitters that are essential for memory and concentration. These changes can cause forgetfulness, difficulty thinking, and mental confusion. The problem is that these symptoms can be confused with natural aging. But what if the real culprit is that medicine you take? Often, the damage is only noticed when it has already worsened. It is critical to understand which medications can impair brain function. Fortunately, there are ways to reduce these risks and protect your cognition. Now, find out if there is still time to reverse the possible damage. These drugs can cause dementia. Is there still time to reverse them? Many people only notice the damage when their memory is already compromised. But can stopping the drug reverse this effect on the brain? This depends on the time of use and individual genetic predisposition. Some research indicates that the brain can recover certain cognitive functions. However, recovery depends on adjustments in treatment and lifestyle changes. Suspending a medication without medical advice can be extremely dangerous. Therefore, consulting a specialist is essential before any change. In some cases, there are safer alternatives with no impact on memory. Now understand exactly what happens in the brain with these drugs. Subtitle: What happens in your brain when you use these drugs every day? The brain relies on neurotransmitters to maintain memory, attention, and learning. Some medications alter these neurotransmitters, impairing essential brain functions. Prolonged use can reduce the activity of areas responsible for cognition. This can lead to memory lapses, difficulty concentrating, and mental confusion. Over time, these changes increase the risk of progressive cognitive decline. Studies show that certain drugs accelerate the degeneration of brain cells. In addition, they can decrease the brain's ability to create new connections. These effects can be reversible or permanent, depending on the duration of use. Now, here's why ignoring this alert can cost you your memory. Ignoring this alert can cost you your memory. Find out what to do. Many people only realize the damage when it is too late. Forgetting begins with small lapses and worsens over time. Difficulty concentrating can affect work, studies, and daily tasks. Dementia does not appear suddenly, but develops silently. If nothing is done, the impact on quality of life can be great. The worst thing is that many ignore the first signs and continue to use it. The best strategy is to identify the risks and act quickly. Consulting a doctor can help find safer alternatives. Now here's how to tell if a drug is destroying your cognition. How do you know if a drug is silently destroying your cognition? Some signs may indicate that a medication is affecting your memory. If you forget appointments or lose objects frequently, be aware. Difficulty concentrating or reasoning can also be a wake-up call. If you notice changes in mood or mental confusion, investigate the cause. If symptoms have arisen after starting a medication, there may be a relationship. The ideal is to talk to a doctor to assess the risks involved. Tests can identify if there are cognitive changes associated with continued use. If necessary, there are safer alternatives to preserve your mental health. Now find out which folk remedies can increase your risk of dementia. 13. Folk remedies that can steal your memory. The last one is the most dangerous. 1. The danger hidden in anxiety meds. It could be happening to you. Benzodiazepines are common remedies for anxiety, insomnia, and stress. Popular examples: diazepam, lorazepam, and alprazolam, used by millions. They act by increasing the activity of the neurotransmitter, GABA in the brain. This effect promotes relaxation, anxiety relief, and temporary sleep improvement. Despite this, prolonged use carries serious health risks. Memory and learning can be negatively affected over time. Studies show a relationship between benzodiazepines and dementia risk in the elderly. A French study pointed to a 60% increase in cognitive risk. In addition, these medications cause significant physical and psychological dependence. Many people find it difficult to stop using it on their own. Weaning should be done with appropriate and gradual medical guidance. There are natural and effective alternatives to anxiety and persistent insomnia. Cognitive behavioral therapy is a safe option with no side effects. Breathing and meditation techniques also help with emotional control. Avoiding continuous use medications can protect your mental health. Be aware, another common remedy can also affect your cognition. Find out what it is and how it acts in your brain. 2. The silent impact of anti-allergy drugs and urination drugs. Is your brain at risk? Anticholinergics are used for allergies, urinary incontinence, and colds. Common examples include diphenhydramine, oxybutynin, and motion sickness medications. They block the action of acetylcholine in the brain. Acetylcholine is essential for memory, focus, and learning. Without it, mental confusion, forgetfulness, and cognitive slowness arise. Long-term use of these remedies can be dangerous. Studies link its use to increased risk of dementia. The University of Washington confirmed a 54% higher risk. The problem is that many are sold without a prescription. They are used frequently, without guidance or control adequado. Calm time, the side effects accumulate silently. Lifestyle changes are safer alternatives. Natural treatments also help without affecting your cognition. Before continuing to use, talk to your trusted doctor. Never interrupt on your own without professional guidance. Pay attention to the signals from your body and mind. Now, discover a common antidepressant that can affect your memory. You may be using it without knowing the risks involved. 3. The antidepressant that may be affecting your memory without you knowing it. Tricyclic antidepressants are widely used to treat depression, anxiety, and chronic pain. Among the most prescribed are amitriptyline, imipramine, and nortriptyline. They act by regulating the levels of serotonin and norepinephrine, neurotransmitters that are fundamental for mood and well-being. However, in addition to these positive effects, these drugs also have a strong anticholinergic action. This means that they block the action of acetylcholine, a neurotransmitter that is essential for memory, learning, and attention. As a result, its prolonged use can compromise cognitive function. Scientific studies have shown that patients who use tricyclic antidepressants for long periods have a higher risk of developing dementia. A study involving more than 400,000 patients confirmed this worrying relationship, especially at high doses or in prolonged treatments. The effects vary from person to person, but the cognitive impact is a growing concern among experts. If you use these medications, it is important not to discontinue on your own. Talk to a doctor or psychiatrist to assess the need for adjustments or changes. There are more modern and safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs, which usually have fewer effects on cognition. Now get ready. Antipsychotics, another group of medications, can also profoundly affect the brain. Find out how in the next content. 4. The psychiatric drugs that may be accelerating dementia. Without you realizing it, antipsychotics are drugs used in the treatment of psychiatric disorders such as schizophrenia, bipolar disorder, delusions, and intense agitation. Among the most prescribed are haloperidol, risperidone, and quetiapine, known for their effectiveness in controlling severe symptoms. These drugs act mainly on neurotransmitters such as dopamine and serotonin, regulating the brain circuits responsible for behavior, perception, and emotion. Despite the benefits, prolonged use of these drugs can bring important side effects. One of the main risks is cognitive impairment, with symptoms such as difficulty concentrating, slow thinking, and memory lapses. Excessive sedation is also common, directly affecting patients' quality of life. Scientific studies have shown a link between the continued use of antipsychotics and an increased risk of dementia, especially in older people. Research published in the British Medical Journal reinforced this concern by showing that older patients are particularly vulnerable to these effects. In many cases, adjustments in doses or substitution with safer alternatives can reduce these impacts. Therefore, it is essential to maintain constant medical monitoring and never interrupt treatment without professional guidance. Now, be careful. Even a simple heartburn remedy can affect your memory. Find out in the next content how this happens. 5. Heartburn. Meds that may be harming your brain. H2 blockers are used to treat heartburn, reflux, and gastric ulcers. Among the main ones are ranitidine, famotidine, and cimetidine, which are widely prescribed. They work by reducing the production of acid in the stomach, providing immediate relief. Despite its effectiveness, prolonged use can generate worrying effects on the brain. Studies indicate that these medications can compromise cognitive function over time. This is because the reduction of acid interferes with the absorption of essential nutrients. Vitamin B12, crucial for the brain, relies on acid for absorption, adequata. Calm. B12 deficiency. Symptoms such as memory loss and confusion arise. In addition, research links these drugs to an increased risk of dementia. A study of older adults revealed poor cognitive performance in long-term users. Patients who had used H2 blockers for years showed significant mental decline. The effect appears to be related to the dose and duration of use. While they are effective for the stomach, they should be used responsibly and cautiously. Alternatives include dietary changes, such as reducing fried foods, caffeine, and processed foods. Natural therapies, such as digestive teas and healthy habits, can relieve symptoms without risk. Always consult a professional before starting, changing, or suspending any medical treatment. If you use these drugs frequently, evaluate the risks with your doctor. Now find out how seizure medications can silently impact your cognition. 6. Seizure medications that can silently compromise your cognition. Antiepileptics are essential to control seizures and other serious neurological disorders. Among the most used are phenytoin, valproic acid, and carbamazepine. These drugs work by stabilizing brain electrical activity, preventing recurrent epileptic seizures. Despite its effectiveness, prolonged use can negatively affect cognitive health. This is because they reduce neural excitation, impacting brain plasticity. Plasticity is essential for learning and forming new connections. When compromised, difficulties in reasoning, memory, and ability to concentrate arise. Studies show that chronic users face more cognitive problems over time. Researchers have identified a higher risk of cognitive decline among older adults on ongoing treatment. In addition, these medications can cause mental fatigue, drowsiness, and mild confusion. The impact varies according to the dose, the time of use, and the patient. In many cases, adjustments in dosage significantly reduce side effects. Never change medication on your own. Always consult a healthcare professional. There are more modern options with less impact on brain cognitive function. Evaluating risks and benefits is essential to maintain quality of life. If you use antiepileptics frequently, talk to your trusted doctor. Now, be aware. Some cholesterol drugs also affect your brain function. Discover in the next content the hidden dangers behind these popular medications. 7. The cholesterol meds that may be robbing you of your mental clarity. Statins are widely used to lower cholesterol and protect the heart. Among the best known are atorvastatin, simvastatin, and rosuvastatin, which are widely prescribed. They inhibit an enzyme that is essential in the production of cholesterol by the human liver. This mechanism helps prevent heart attacks, strokes, and other serious cardiovascular diseases. Despite the benefits, studies point to possible negative effects on cognitive function. Some research suggests that statins may reduce coenzyme Q10 in the body. Coenzyme Q10 is essential for the energy of cells, including neuronios.com. Less Q10, there can be mental fatigue, lapses, and difficulty concentrating. In addition, there are reports of mental confusion after starting treatment. One study looked at patients on long-term statin use, particularly the elderly. The results showed a slight increase in the risk of dementia over time. However, the data are still inconclusive and require further research. Each organism reacts differently, and not all will have the same effects. If you take statins and notice cognitive changes, see your doctor immediately. There are natural strategies to control cholesterol, such as a balanced diet and exercise. Foods rich in fiber and antioxidants help keep cholesterol in check. Never interrupt treatment without proper and personalized medical advice. Now find out how reflux remedies may be silently impairing your memory. 8. Reflux remedies that can take a heavy toll on your memory. Proton pump inhibitors, PPIs, treat reflux, gastritis, and stomach ulcers. Among the most common are omeprazole, pantoprazole, and esomeprazole, which are widely prescribed. They drastically reduce the production of acid in the stomach, relieving discomfort. Despite this, prolonged use can cause worrisome side effects to the brain. Low gastric acidity hinders the absorption of nutrients essential to health. Vitamin B12 is one of the most affected by this absorption deficiency. This vitamin is essential for memory, concentration, and system health nervosocom. Low levels of B12, symptoms such as mental confusion and forgetfulness arise. Studies indicate that continued use of PPIs increases the risk of dementia. Research from the University of Bonn observed cognitive decline in frequent users. Elderly people and people with a predisposition are more vulnerable to side effects. Adjusting the dose or seeking alternative treatments can reduce these negative impacts. Dietary changes and the use of natural antacids are safer and more effective options. Do not discontinue use on your own. Always seek appropriate medical advice. If you use PPIs daily, assess the risks and talk to your doctor. Prevention is the best way to protect your digestive and brain health. Now, discover the dangers of strong painkillers and their impact on cognition. 9. Strong painkillers. Is pain relief costing you memory? Opioids are potent pain relievers used for severe, acute, and chronic pain. Among the most common are morphine, oxycodone, codeine, and the potent fentanyl. They act on the brain by reducing the perception of pain and promoting relaxation. Despite their effectiveness, they also affect brain areas linked to memory and attention. Prolonged use can cause mental confusion, forgetfulness, and difficulty concentrating. Studies indicate that opioids accelerate cognitive decline, especially in the elderly. The University of Minnesota has linked its continued use to dementia risk. These drugs still have a high potential for physical and psychological dependence. Interruption can cause withdrawal symptoms and worsening mental functions. Therefore, use must be carefully monitored by a qualified professional. Alternatives include physical therapy, acupuncture, and natural pain management techniques. Integrative therapies can offer relief with less impact on the brain. Each organism responds differently, so the evaluation must be individual. Never stop treatment on your own. This can aggravate symptoms. If you use it continuously, talk to your doctor about other options. Preserving cognitive health is just as important as treating pain. Now, see how hormonal contraceptives can also affect your cognition. 10. Hormonal contraceptives. The surprising relationship between these drugs and dementia. Hormonal contraceptives are used to prevent pregnancy and regulate the menstrual cycle. Among the most common are combined pills, patches, and injections with synthetic hormones. They contain artificial versions of estrogen and progesterone, which affect the entire body. While effective, studies suggest that they may negatively impact female brain function. The brain has hormone receptors that influence memory, mood, and learning capacity. Hormonal changes can affect communication between neurons and reduce neuroplasticity. Some women report memory lapses and difficulty maintaining concentration. Studies indicate that prolonged use may be related to cognitive decline. Research is still ongoing, but the first results are worrying and relevant. These effects vary from person to person, depending on the dose and time. If you have noticed cognitive changes during use, seek expert medical advice. Non-hormonal alternatives, such as the copper IUD or condoms, may be considered. It is important to weigh the benefits and risks before starting any contraceptive method. Brain health deserves attention, especially in continuous use treatments. Never interrupt or change your method on your own. Always consult a doctor. Now, find out how corticosteroids may be silently affecting your brain function. 11. Corticosteroids. Can prolonged use affect your cognition? Corticosteroids are used to treat inflammation, allergies, and various autoimmune diseases. Among the most common are prednisone, dexamethasone, and hydrocortisone, which are widely prescribed. They reduce inflammation in the body, providing quick and effective relief from symptoms. However, prolonged use can have worrying effects on the brain. These drugs can alter the hippocampus, an essential region for memory and learning. Patients on continuous treatment report memory lapses and difficulty concentrating. Studies associate chronic use of corticosteroids with increased risk of dementia. The Mayo Clinic has identified cognitive decline in long-term users of these substances. In addition to memory, corticosteroids affect sleep, mood, and anxiety. It is common for patients to experience insomnia, irritability, and even episodes of mental confusion. Side effects vary according to dose, time, and individual sensitivity. Adjustments in medication can reduce these impacts without compromising the main treatment. It is also possible to consider less aggressive alternatives, always with medical advice. Never stop using corticosteroids without proper professional supervision. If you use them frequently, talk to your doctor about possible replacements. Now, discover the silent impact of high blood pressure drugs on your memory. 12. High blood pressure meds. A hidden risk to your memory. Antihypertensives are essential to control blood pressure and prevent strokes. Among the most common are beta blockers, diuretics, and ACE enzyme inhibitors. They lower blood pressure by protecting the heart and blood vessels. However, some can affect cerebral blood flow significantly. Reduced circulation compromises the supply of oxygen and nutrients to the brain. This can cause dizziness, memory lapses, and slowness in daily thinking. Studies suggest that certain antihypertensive drugs increase the risk of progressive cognitive decline. Researchers from the University of Toronto have identified mental impairment in hypertensive older adults. The type of medication and genetics influence the side effects observed. In many cases, the impact can be minimized with adjustments to the medication. Never change or discontinue treatment on your own, even with cognitive symptoms. Talk to your doctor to evaluate alternatives that protect brain function. There are safer options for high blood pressure with less risk to the mind. Lifestyle changes also help control pressure naturally. Physical activity, a balanced diet, and stress reduction make a big difference. If you use antihypertensives, monitor your cognition and health carefully. Now find out how allergy medicine may be damaging your memory. 13. Long-term antihistamines. Your allergy medicine may be making you forget more. Antihistamines are widely used to treat allergies, itching, and colds. Among the most common are diphenhydramine, loratadine, and cetirizine. They work by blocking histamine, a substance responsible for allergic reactions. However, many also have an anticholinergic effect, interfering with acetylcholine. Acetylcholine is an essential neurotransmitter for memory and learning. Its blockage can cause mental confusion, drowsiness, and memory lapses. Studies indicate that continuous use can increase the risk of dementia. Research from the University of Washington observed cognitive decline in frequent users. The elderly are more vulnerable to the side effects of these medications. If you take antihistamines regularly, consult a doctor about alternatives. Now here's how to protect your memory and reduce these risks on a daily basis. Taking care of your memory is just as important as taking care of your body. Often, we take medications without knowing their long-term effects. But now, you have the knowledge you need to make better decisions. If any of the remedies on this list are part of your daily life, don't panic. The first step is to talk to a qualified health professional. There are safer alternatives and strategies to protect your cognition. In addition, healthy habits help strengthen the brain and reduce risks. Exercise. Eat a balanced diet and sleep well. Information is your greatest ally to preserve your mind and your quality of life. Now that you know these risks, share this knowledge with others. Your memory is golden. Take good care of it.